Hey guys, I'm going to attempt to show you what I have in mind for the video. Of course, you're not going to have the screen behind me, which is pretty cool. But anyway, okay. Medical careers, pharmacists. What is a pharmacist? Professional qualified to prepare and dispense medications, have expertise in the composition, effects, metabolism, mechanism of action, and proper usage of drugs. And real quick before I go on, I am dressed in my pharmacist attire. Got on my nice shirt, my hair is in a professional bun, got my earrings, trying to look professional. I couldn't find my lab coat. Educational requirements. Must have a doctorate of pharmacy, which is a PharmD. It is a 4-year program. There are some, I think there's 2 schools in the United States that have a 3-year program that's year-round, but essentially it's a 4-year program. In order to apply and enter pharmacy school, you have to have completed the required coursework in biology, physics, chemistry, mathematics, humanities, and social studies, which are the kind of gen eds. I looked up the average grade point average of the entering students in pharmacy school, so those coming out of their undergrad or their bachelor's degree, was a 3.4. You also have to have the PSAT, or no, it's the PCAT, sorry. It's the PCAT, which is a pre-pharmacy test that you have to take. And they suggested 90th percentile was a good place to be accepted. I will say I had a friend, the first time she took it, she got a 54. And of course she retook it many times. Now she is a nuclear pharmacist. So, and also when you were registering for pharmacy school, they look at your extracurriculars, community service, any sports, intramurals, clubs, that kind of thing. So I already mentioned, usually those prereqs you can get done in 2 to 3 years, then pharmacy school. So the minimum, absolute minimum you're looking at is 6 years. Most people do it in 7 or 8. So required skills, and these are just a few. Multitasking, communication. You have to be able to communicate with your patients, with other doctors, with other pharmacists. Patient counseling, you have to talk to them about their meds, how to use it, what to expect. And also interpersonal skills, which goes along with the communication with everyone. Accuracy, you have to be pretty accurate. You're handling, people's medicine, very important. Computer skills, you got to be able to input the drug or input the prescription. You got to be able to utilize your online database to look up drugs and interactions and all that. Constantly learn. To be a pharmacist, you have to do continuing education every year, 15 units. It's called CEs, and that's just in the state of Kentucky. Every state differs. You have to be ethical and have to maintain integrity. You have to be honest with your patients. You can't go talk to one patient about something, go running to another, be like, you know what I heard? That's a violation of HIPAA. You'll get fined and lose your license. Advocate. You have to advocate for your patients. Doctors might have called in the wrong thing, potential drug allergy. You got to call the doctor, say, hey, this isn't what this patient needs. Math skills. Every day as a pharmacist, you're going to use your math skills. And diplomacy. You got to stay calm in rough situations. So next is salary. If you look at the hourly rate, in Kentucky, the average rate is $53.24 an hour. In the US, broadly, the average rate is $66 an hour. And there's different pharmacists. You can be a pharmacist and do something completely different. There's research pharmacists, there's retail pharmacists, which is like working at Walmart, Kroger's. There's hospital pharmacists, there's nuclear pharmacists, like I mentioned my friend. There's a ton of different kinds of positions you can do. Usually retail is the most paying in general because it's the most hectic. Hospital, a little bit more intellect, but more laid back. You're not on your feet necessarily 10, 12 hours a day. But nuclear, of course, a specialty pharmacy would be expected to have a higher salary than like just plain retail. I know where I was, if you worked 6 days, which is what the pharmacy was open, some pharmacists did, you could bring home about $2,000 a week. That's after taxes. Job duties and type of work. You have to advise patients about medications, how to take them, what to expect, what it's for, and that goes for prescription and over the counter. And you'd be surprised how many over the counter questions you get, which is the medicines that you can buy without a prescription, like Tylenol, Pepto-Bismol, all of those. You have to ensure prescription is appropriate for the age, the disease states that the patient has, other medications, etc. Verify the prescription is valid patient, valid doctor, valid diagnosis. Patient counseling, you, a pharmacist, is the most available healthcare professional. So you can't just walk into a doctor's office and say, hey, let me go see the doctor. But you can walk into a pharmacy and say, hey, can I ask the pharmacist a question? And people do that, and that's what we're there for. But there's a lot entailed. You have to be a problem solver. You have to, if there's a problem with the insurance, try to figure out what's going on, have to call the insurance, figure out why the patient's insurance isn't paying for certain medicine, allergies, etc. Medication therapy management, that's basically patients that are on multiple prescriptions, making sure that they don't interact and cause more harm than good. Especially retail requires standing in one spot for long hours. If you are the only pharmacist, you are not allowed to leave the building once the doors open until they are closed and locked. So say like Holbrooks. Once a pharmacist unlocks that door, if they're the only pharmacist there, they can't step outside. They're not even supposed to step outside to smoke. They're supposed to stay in between those in between those walls until the entire pharmacy is closed and there's no patients in there. Likewise, if you're the only pharmacist, your bathroom break depends on how busy you are. Your lunch break depends on how busy you are. Reality, I'm sure the bigger chains, they have to take a certain lunch break at a certain time, but most of the independents, you take care of your patients, so you only go to lunch whenever your patients are taken care of. So you must be quick thinking and very good at multitasking. Job benefits and drawbacks. I'm going to go through some pros. The pay is good. Usually if you're working a 40-hour week, of course, you're making 6 figures. There's a variety of pharmacists to choose from, retail, hospital, there's even some online. Everyone needs a pharmacy. Everyone has to get their medicine somewhere. So if you are a pharmacist, there's usually always job openings pretty much anywhere. You can open up your own pharmacy and be self-employed. You can choose your hours, flexible hours compared to any other professional degree. You can do 5 8-hour days, 4 10-hour, 3 12-hour shifts. When I've worked maybe 28 hours a week and was considered full-time. So I only worked about 3 days a week and still got full-time benefits. Pharmacy is growing. There's a need. You get to help people, even if it's just to listen. You are usually, the pharmacist is the first person the patient sees after leaving the doctor's office. So if they went to the doctor's office, said, hey, you have cancer, here's the medicine you need to be on, we're the first person they see. And that has happened many times. And sometimes it's not included with your job title. You don't have to, but sometimes you just need to be there for the patient. You get to share your knowledge with others, counseling. And it's an opportunity to share God's love. Like I said, there's been patients that have come in that I've I've asked if I could pray with them and help them. You see a lot in a pharmacy. Okay. Cons, drawbacks. You can get your PharmD. You can go to 8 years of school, 4 years of undergrad, get your bachelor's, 4 years of pharmacy school, and you can get your PharmD and never become a registered pharmacist. You have to pass a course, a test, after you graduate with your PharmD. So you can have your doctorate in pharmacy and never become a registered pharmacist. So that's a drawback. However, even with your doctorate of pharmacy, there's other things you can do, like teaching. Very stressful at times. Some days are better than others. Never forget when I first came out, there was one day, the first real busy day we had, I didn't eat lunch. Got there at 8:30, didn't eat until 4:30. There just wasn't time. Money isn't everything. That's a drawback. Yes, you have to have money, but money isn't everything. You need to make sure you look at your family situation. And just a little plug there. You know, when I was young, first going into pharmacy school, I wanted that fast-paced, stressful multitasking. I loved that. I thrived on it. When I came out of pharmacy school with 2 kids, and I had 2 kids later, it was much harder to multitask with parenting in a high-stress job. I'll say that. Your attentiveness or lack thereof can cost someone their life. So you've got to be able to multitask and do it well and focus. Education. Of course, the more years you're in school, that adds to your debt. You stand a lot. And as you get older, it gets harder. The 10-hour days to y'all teenagers probably doesn't seem that bad. But day after day after day, it gets pretty hard on your feet, on your joints. There is competition. So pharmacy is growing, but there's also pharmacists that are out there that want jobs too. So just, there's jobs open everywhere, but that doesn't mean that you're going to get that job. It's competitive. People aren't always nice. I've been chewed out, I don't know how many times, screamed at over the phone, bawled out face to face. Sometimes it was something the pharmacy could have helped. Usually it wasn't. People just aren't always nice. You must always be 100%. Like I said earlier, if you aren't thinking clearly, someone can get hurt. And you got to wear dress clothes and look professional all the time. So that one's kind of a joke. But now, don't freak out. This is a little bit more in depth than what I expect your alls to be. Obviously, I have a history with it. I can put a little bit of plugs of personal information in there. But I do want you all to cover the basic information, which is what our outline is. So the outline doesn't specifically say, but at the very beginning, you kind of need to give a little synopsis of what your medical career is, what they do. Then the educational requirements, the required skills, the salary, the job duties / type of work, and the job benefits and drawbacks. There's always benefits and there's always drawbacks, and they are going to be very personal to you. So let me know if you all have any questions with any of the information. I don't expect you all to have a green screen. We're probably, hopefully, Lord willing, going to be in class and be able to do this in person. But I had the stuff, so I thought it'd be fun. Hopefully see y'all soon.